malaria is fine. So I have malaria. Then I'm given a dosage. Like I'm given a whole strip. I'm supposed to finish in like 3 days, and I have maybe I do 2 days. I have 1 day left. So I have 1 day left for this particular one. I probably have some
next
2 days
course,
left.
yeah.
So now
You have
when,
a
I,
new
have,
full
when I have
course.
malaria, I have a new full course.
Yeah.
Is this something that we should do? I mean, one, I know it's bad to not to finish medication, so that I'm not encouraging anybody to do that. And some way, somehow, I try to do herbal when I stop. So malaria medication gets me weak. So that's the reason I usually want to avoid it, because then I'm not able to do so many things I want to do. So that's why I run away from it. Then when I'm done, I get onto herbal, something either I cook or something that I trust. But is that something that should be done? That I have this medication, the day I had these symptoms or I had this pain from here, I was given this at the hospital. So I have the rest down. Anytime I feel that kind of pain, I go and catch. That becomes more like I have a whole drugstore. Is this something that should be encouraged? Or once I don't finish it, I should throw it away?
Yes. So for starters, if you're a good patient, you shouldn't even have those spare courses sitting there. So we'll start from there. So a good patient shouldn't have that in the first place. But in a case where you do, even now we are trying to move into a system where we test the malaria before treating. It's no longer a case of, oh, I know how I get my malaria. So once you see those symptoms, then you rush and you take it. Yeah. We are trying to go back to test and be sure before you treat. Exactly. So that you know that you're actually treating malaria. Because another thing with malaria is its symptoms, it has very generic symptoms. Almost every condition, you can have those kind of symptoms. So what's the guarantee that it's actually malaria? So why not just test first before you treat it? So the rapid tests, it seems most do give false positives and false negatives. So in that instance, the best thing to do is to go to a lab. I mean, these days, even the blood draw malaria test, you should get it in about 15 minutes. Okay. So then just get a lab, do the blood draw. That one, if it's negative, I mean,
it's negative.
It's negative. There's no two ways about it. So then you should rather adopt that system as opposed to still doing the rapid diagnostic test, because already you don't even trust it in the first place. But then, so once you go to the lab and you do it, that one is definitive. So whatever it says, then you know that if you have it, you're actually treating the malaria. Okay. Yeah.
All right. So you mentioned that antibiotics are not first aid.
Yes.
And that's one thing that a lot of people, I feel, that abuse. Because I was telling you that the documentary on the BBC recently mentioned that even kids are now resisting antibiotics because of the way they are taking them. Some because of the quality, but mostly because of the way they are used. How do we deal with that?
So, naturally, I think for antibiotic resistance, it's multifaceted. For starters, maybe in our system, it's not as bad as it is in the West, where even their poultry, their animals, they are given antibiotics and all that. So all these things are also introducing antibiotics into your system. So it's like, as we go through life every day, we are to some extent trying to build resistance even without knowing. Then now to come and add taking antibiotics recklessly. Someone has a cold, then you jump to antibiotics. But a cold is viral.
Okay.
And viruses are self-limiting. Viruses cure themselves. So with viruses, they run their course, they are done. Yeah. So once you have a cold, an antibiotic should even be on your mind. But in our system here, once someone has a cold, last minute cold, me go far away, and I call it, you see. Yeah. So to them, that's their only solution. But a virus will cure itself. Even if you don't take anything, it will cure itself. Okay. So even sometimes, I like to tell people, so far as the symptoms you are having, if your nose is running, if it's not bad, such as you are walking, your nose is dripping, right. Okay. You can even just leave it and let your system deal with it. Clear it. Yeah, that's why we have our immune systems. Okay. So some things you don't rush to treat. Yeah, so in that case, you let it run its course. There's even a study where they looked at kids born via C-section and preterm babies. They did it in 10 countries. And they realized that those kids have more genes that are resistant to antibiotics.
Preterm babies or
yes, preterm babies and babies born via C-section.
Okay.
So even as you are coming into life, you've already come with some genes that will make you resistant to antibiotics.
Wow.
So imagine, and then you get exposed. Sometimes you have an illness, you go to the hospital, you're there for like 2 weeks. You get exposed to all these things in the system, the food we eat, the water we drink. There can be antibiotics in them, like I was saying about the poultry and the livestock. So all these things are building up, and then we are getting resistant. The medications, you take it halfway, you leave it. Like I was saying earlier, the bacteria, they're always looking for ways to evolve. So they're always looking for ways to have the upper hand. So once you give them the chance, they'll also take it.
Okay.
Bacteria are very opportunistic. You can have bacteria on your skin. We have bacteria that lives on our skin, and then it just gets one chance, enters a part of your body. The next thing you know, you have a very serious infection. Yeah, and it was just bacteria that was on your skin. You were going about your daily life with it. So that's how dangerous bacteria can be. But it seems with that, because we don't see the consequences immediately, we are not willing to be proactive and take the steps to actually prevent it.